Oh, hello.
Oh, what's going on there? What happened? There we go. Acupuncture before?
Nope.
A lot of firsts today, eh? Between the adjusting and the needles. Well done. So that's probably the most painful one. Okay, I thought I'd just get the most painful one out of the way. I promise you, the other ones are not as bad. Okay.
Okay.
Okay, sure. Yeah, totally. You're a sport. You're a real sport. Okay. Eric, it's really good to see you again.
Good to see you. Thank you.
So Eric has a really, really cool job. I met him the other day at a networking event. Eric, do you want to kind of share a little bit of what you do, if you're comfortable with that?
Yeah. So I'm a film student,
Mm-hmm.
aka I'm a filmmaker as well. I make directed short films like documentaries and some narrative. I've done 5 already, so I'm working on 5 right now. One is a World War II veteran. And so. Getting his story out at the age of 100, and this guy is such an incredible hero, and I get to hear his story. So, yeah, just working on that at the moment.
So that's so cool. Honestly, I really think that it's interesting that you're able to document these probably really serious and drastic stories in a visual sense. Because I'm going to be honest, I don't feel like many people read these days. I don't think people will read, but I would definitely. That's something I'd watch. So whenever it's up, please let me know. Okay. But you're in today dealing with kind of like a shoulder thing, right?
My left shoulder has been very, very like sore, and it has been bothering me for the past years.
Okay.
Mainly because it's been cracking.
Okay.
Sometimes
was that it right there?
That's it right there.
Mike probably picked that up. Yeah. Okay.
And then it would sometimes I would feel like it might have been maybe connected to my chest, and then so that's been going on for quite a while now.
Okay.
And so I know this is my first time visiting here, so I just want to get that resolved, and hopefully that crack will go away.
Sure, no problem. Okay, so I think I read through your intake form, and you mentioned that you had done some physical therapy for it before in physio, right? So what was the physio's impression? Did they ever give you a diagnosis? What was their treatment plan?
Yeah, so they told me to do regular exercises with using light dumbbells.
Okay.
So for example, I would do this to kind of work on the rotator cuff.
Okay.
So when I get checkup as well, they would kind of massage it's kind of inside here of the muscle.
Right.
To get that working out. So so they would have been helping me with that.
Did they ever give you a diagnosis as to which? Because patients will very often come and be like, "Oh, I have a rotator cuff issue." Well, we actually have 4 rotator cuff muscles. Did they ever tell you which one it was, or?
I do remember I remember he said there was a specific muscle that's causing it to crack. I just don't remember the name. And he said you might have this type of diagnosis. I just forgot.
Yes, that's okay. Think on it. And if not, we'll come up with our own reason here. But so this clicking has been going on for how months, you said, or how
Probably
long?
Years.
Yeah. Okay. So anytime we're dealing with something that's been going on for a long time, if it's chronic, obviously understand that it takes longer to get to that better. Okay. Whereas if somebody just, let's pretend, hurts their neck, you can usually get it better pretty quick. But if it's been there for a long time, it's possible we've developed some instability or deconditioning, so we have to fight against all of that. Okay. It doesn't mean it's not possible, just a little bit more of an uphill battle there. Okay. Was there ever a traumatic incident? Did you fall on that shoulder? Did somebody body check you, or
Oh, I get body checked when I play basketball.
Oh, but okay, that's good.
But the cause of it, I think it was. I to be honest, I don't know.
That's fine.
It might have been because sometimes when I do push-ups, it might be working on the muscle here. Or when I do, for example, I play basketball as well, and so when I do a jump shot, it might have extended the shoulder.
You feel like it almost shot out of socket.
Maybe.
Okay.
So it might have been that, but in that case, I don't know.
And then what movements right now do you find cause that clicking or otherwise cause? First off, is the clicking painful or is it just the clicking?
It could be painful if it's positioned at a certain spot.
Okay.
So
it's almost as you're bringing it up and back there.
Yeah.
Okay.
Oh, yeah. So,
all right. But what movements are you finding that are getting the most weight? I guess that you kind of actually just answered that. It's going to be your shoulder extension and also some abduction, which is bringing it up. Okay. All right. Fair. Okay. Anything else? Any other complaints we're looking at? Or is it really just related to that shoulder?
It's pretty much just mainly the left shoulder.
Sounds good. Okay, so what we're going to do today then is we're going to get into a physical exam. Okay, I'm going to come up with what I think is causing this discomfort, and then we're going to treat you for it. Okay, I'm going to lay out a treatment plan for what I think would ultimately get you some improvement. Does that sound okay?
Yeah, sounds
perfect. It's been a minute since we've had a shoulder on this channel, so let's go ahead and do a full exam for you guys to see. So, getting started, Eric was saying that bringing his arm kind of up into abduction, which is to the side, and then extending it backward was kind of provocative. So first thing I'm going to do is I'm actually going to get you to bring this arm up into flexion. Keep it right there.
Yep.
I'm going to push this down. Does this cause any pain at all in the shoulder for you, or is it otherwise difficult?
No.
Okay, fight me. Don't let me push you down. Strong. How about now?
No.
Even with the wincing, huh?
Yeah.
Okay. Let's turn this over. Keep that thumb down, and same deal. Don't let me push you down. Fight.
No pain.
No pain? Awesome. Okay? Relax right there. Okay? I'm going to bring this arm up. Keep your arm here. Don't let me pull you back towards me. Is that okay? Good. And same deal. Don't let me push your arm forward. That's okay?
Yeah, I'm good.
Put this hand behind your back for me.
Yep.
Are you able to lift it up off your back?
Like that.
And touch the wall there? That's all okay?
Yeah.
Okay, good stuff. Relax there. Relax here. And then what we'll do here, bring you up forward.
Hello.
Oh, what's going on there? What happened?
Just a little
bit of a pinch in the shoulder. Where in the shoulder?
I think
right there.
Like here, yeah.
Okay. Now if I relax that and bring you up like so, any pinching there or not really?
No,
it's really only on that one there.
Yeah.
Okay.
Yeah,
Good. And then again, same concept. If we bring you up and back like this. This was the original movement you were saying the chair was hurting, but now it's not hurting you, is it?
No, yeah.
Weird how that works. Okay, move it around once again, just yourself. See if you can cause it yourself. Okay, wow.
Yeah.
Once again, go ahead. Okay, so when he's doing this, what I'm feeling with my hands is we're getting anterior translation, which is the fancy medical way of saying that his humeral head or shoulder, his arm bone here, that's how you say it simply, is literally popping forward when it does this. Okay, so anytime we're getting that kind of popping movement, we usually refer to it as instability. Does it mean that it's actually unstable? No, his arm's still in socket, it's not falling out, but that's the term we kind of use. So we're going to poke through the upper back. Now I know you said it was the left shoulder that's bothering you. Yeah. So as we go through here, does that feel particularly tense or uncomfortable for you?
Oh no, yeah, it's I feel the little pinch, but yeah, that's fine.
Okay. Ooh. So he feels a pinch, but goes, oof. So I'm not sure whether to believe his words or his vocalizations. So I'm going to go with the vocalizations because they reveal all. Okay, so there's a little pop, not even intended to do it, but that's fine. Those are my elbows, not him. Oh, wow. Did you feel that one, though?
Oh, yeah.
That was a good one. Okay, so let's bring the mic a little closer and see what else we got in here. I'm going to get you to take a big breath in for me. We're going to adjust, okay? Big breath in. All the way out. There we go. You okay?
Yeah.
That wasn't painful?
Oh, that was good.
That felt good? Good. I'm glad you think so. So that's good. So there's definitely tension on this upper left side, and that kind of makes sense to me. If we're getting issues with this shoulder sliding forward, it's possible that the rotator cuff muscle isn't doing its job, specifically the infraspinatus and the teres minor. We'll put pictures of them up there so that you guys know exactly what I'm talking about, and I'll show you on my anatomy app afterwards. But because of that lacking, we're probably going to get overworking of the rhomboids, or the actual muscles back here that hold the shoulder blade backward. So what I'd want to do is work to strengthen both those things. Okay, this one so it increases its tolerance, and this one just so it does its job properly. Anytime we're having a shoulder issue, I really do like to try to include acupuncture as a primary treatment method for those things, because acupuncture can be very beneficial to shoulder range of motions. Here, just actually relax the hand.
Just relax.
Well, let this.
Oh, yeah.
Yeah.
Gotcha.
I mean, if you're comfortable holding that, because this does slide a bit, we can do that. Are you comfortable holding the shirt for me?
I can hold it.
Perfect.
Yeah.
All right, so holding that right there.
Is that good? Okay.
That's perfect, right? Just like that. Awesome. So I'm going to start. First needle's coming in. We'll get you to just hold it right there. Awesome. You ever had acupuncture before?
Nope.
A lot of firsts today, eh? Between the adjusting and the needles. Well done. So that's probably the most painful one. Okay, I thought I'd just get the most painful one out of the way. I promise you, the other ones are not as bad. Okay.
Okay.
Okay, sure, yeah, totally. You're a sport. You're a real sport. Okay. All right. See, was that one as bad?
No.
See?
Yeah.
I wouldn't lie to you. 3. This one might be a little bit of a stinger. Nope, we're okay.
Nope. Not too bad.
Alright, good stuff. I feel like this one can go a little deeper. No, okay, there we go. Awesome. Okay, good. So now we just sit tight. Okay. So, all right, you're needle free there. You can let that arm relax. Okay, good job. How was your first Acu session ever? Okay, you survived. Or did you hate it? He hated it, but he survived. All right. So I just finished explaining kind of the biomechanics of this shoulder issue to Eric here. I hope you have a better understanding of it now. I'm going to briefly summarize it for you. Yes, if you don't, I'll reiterate it, I promise, okay? It's complicated, okay? I just crammed 4 years of knowledge into 4 minutes, okay? So don't be embarrassed about that. Long story short, we want to strengthen everything that's on the back of his shoulder, okay? So what is that? That's the external rotation movement, as well as the shoulder retraction movement, okay? So the two exercises, or the two movements rather, because you can do any exercise with these movements, that are going to be most important for him are going to be external rotation of the shoulders, as well as retraction of them. So that's what we're going to do. All right, so first thing that I'm going to walk you through here for external rotation of the left shoulder, basically I'm going to hold the resistance band, you're going to hold the resistance band, and you're going to externally or turn your arm away like that, okay? So go ahead, hold this edge here. I'm going to come on over here out of the view of the camera, and that's kind of awkward because we're really one-sided, but go ahead. I want you to rotate that shoulder outward towards the door. Does that, okay, so I'm seeing some wincing, so that's challenging for you, huh? Okay, go ahead and knock out 9 more of those, okay? Good. Any clicking? No, none yet, right? No. Okay, good. Keep going. Great. Now I really like how you're keeping that elbow tucked in, because that's isolating that infraspinatus there. Okay, keep going. Good. One thing about me is I'm really bad at counting, so I think that's 5.
5, yeah.
Perfect. So, rowing movements, a little bit different. Instead of rotating outward, we're going to be pulling back towards our body. So you're going to grab with this arm, okay, and you're going to, you can bring your arm kind of up to like 45 degrees, let's say, and I want you to focus on trying to squeeze that shoulder blade back towards your back there. Okay, go ahead, pull, 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 pull. I'm just going to move so you don't let go and accidentally hit me in the groin there, okay, and keep going. How's that feel?
It's pretty good. Yeah.
That feels good? Okay, keep going. And knock out 10 of those.
Yeah, I made a little click in there.
A small one? That's
yeah,
okay.
Small.
You can expect to hear these things as you're rehabbing through it. Okay? It's about building up the resiliency. And the one thing I'll mention that is anytime we're dealing with a muscular endurance related complaint, we're looking at least 6 to 8 weeks of consistent rehab input before we start to see improvement. Why? That's because it's how long the body takes to literally adapt your muscles. I'm going to try a shoulder adjustment here. So what I'm going to do is I'm going to get you to, I'm going to kind of give you a hug. Is what this looks like, okay? So you're going to relax this arm with a lazy bicep curl like that. I'm going to come behind you and just relax here. Bring it towards, good. There we go. There's a little small one right there. So that was for the AC joint. Again, another adjustment I do very often on this channel. But I'm happy you were able to get it. Eric, we just finished our first appointment here. We did a couple of things you've never done before. We adjusted you, we therapeutically stabbed you. How did you find all of that? Like, you were a real sport about it, I gotta say. I think you were nervous or hesitant, but you did great. How do you feel now? You're okay?
Yeah, I feel pretty good.
Good, happy to hear. So as we talked about, the shoulder, most of them, especially in this case here, it's a physical therapy fix, okay? Not a physiotherapy. You can see a physiotherapist, but it's a physical therapy. Exercise is going to be the thing to fix you. And exercise sucks because it takes a long time. Okay, it's effective, but it takes a long time. So I promise you, if we stick with this program, and as we make the exercises harder, and as we introduce more and more of them, this shoulder clicking should decrease, okay, and this discomfort and that your function should increase as well, okay? Did you have any questions for me for now, or are we good until our next time?
Yeah, no, I just wanted to make sure that I can still like do physical activities like playing basketball or like when I'm doing push-ups. I don't want it like to affect it, but
yeah. So your concern is that when you're doing this physical activity that you might hurt it or make it worse, or what's the concern?
Okay. I just don't want it to make it worse or anything. Yeah.
I kind of look at this twofold. Okay, with every kind of physical activity, including working out, which I love to do, but some people like to play soccer or basketball, including a sport, there's always with it an inherent risk of injury. Okay, and every person always is more vulnerable to a specific kind of injury or not. So the answer is yeah, you could hurt the shoulder. Okay, but when I look at what the alternative is, which is to just not do the thing, not do the sport, well, that in itself is a decision and has with it its own negative consequences, okay? One of which that immediately comes to mind, like if basketball is your form of exercise, well then you're not exercising anymore. And with that, we can get deconditioning where the shoulder actually becomes worse, or the cardiovascular system becomes worse. And when those things happen, then we're looking at potentially worse issues than, oh, I strained it and it hurts more now, right? So my answer to you is, yeah, absolutely. In fact, I encourage you to keep doing your activity because in my opinion, the potential benefits from that activity far, far outweigh the potential risks, okay? Another practitioner might say something opposite. They say, no, you can't do this. It's too high a risk of injury. But I would respectfully disagree with them. So yeah, please keep doing the things you like to do, okay? Any other questions at all?
No?
No? Awesome. Okay, well, thank you so much for coming in, Eric. Again, we can fix this, and I will see you next time, okay?
All right, awesome. Thank you.